Welcome to the Deep Dive. Today, we're taking a deep dive into a really critical and maybe often overlooked issue, the intensified 2025 White House immigration crackdown. We'll be sort of extracting the most important insights from the sources you've shared, really giving you a shortcut to truly understand its far-reaching impact. And this isn't just about policy paperwork, It's about something really fundamental, how we care for our most vulnerable citizens.
Absolutely. And what's striking here is just how deeply intertwined immigration policy is with the very fabric of our healthcare system, especially when you look at long-term care. Nursing homes, home care, they're uniquely reliant on foreign-born workers. So yeah, we're going to explore how these recent policies are creating a really complex and challenging situation. It reveals this intricate web of reliance and consequence when you look closely at this sector. It's quite fascinating, actually.
That foundational reliance you mentioned,
Yeah.
that really seems like the heart of it, doesn't it? Because, to grasp the problem, you first have to understand who is actually providing the care day to day. And our sources, they paint a pretty stark picture. Immigrants make up a huge, you could argue, indispensable portion of this workforce. Get this, nearly 1 in 3 direct care workers, we're talking home health aides, personal care aides, nursing assistants, is an immigrant. That's, wow.
It's a huge number.
And it gets even more focused in specific settings, right? Like home care.
Exactly. In home care, it jumps to 32%. 32%.
Oh.
And we also saw those specific figures like 41% of all home health aides being foreign-born in 2024.
41%.
And 22% of nursing assistants. So yeah, it's not a small slice.
No, it's clearly the backbone, as you said.
Precisely. And these aren't just, abstract percentages on a page. These are real people providing essential daily care, companionship, really preserving dignity for millions of Americans. When you think about the vital roles they play, often very intimate roles, helping our elderly and disabled populations live fuller lives, it just puts into perspective how absolutely critical this workforce is. Honestly, without them, the entire long-term care system faces, immense strain, maybe even unbearable strain.
Okay, so given that level of reliance, that dependency almost, how are these new policies actually translating into real-world impact? We're hearing terms like mass deportation plans, tightened immigration restrictions. Can you break down the mechanisms? How does it work?
Well, the policies themselves, they kind of range from these broad stroke efforts to more targeted changes. For instance, reports are highlighting the suspension of certain refugee programs. That's one piece. And then there's the potential revocation of temporary protected status, TPS, for, I think the number was around 864,000 immigrants.
Wow, nearly 1 million people.
Yeah, from countries like Haiti, Venezuela, and others. And many of these individuals are already in the care workforce, so their legal work authorization is suddenly deeply uncertain.
And what's the ripple effect of that kind of uncertainty? Does it go beyond just the people directly affected by TPS changes?
Oh, absolutely. It creates what people often call a chilling effect. And this isn't just about who might be directly targeted for deportation, The threat itself, the climate it creates, actively discourages new immigrants from even considering entering the care industry. Why would they, with that hanging over them? And maybe more surprisingly, it causes some documented workers, people who do have legal status, to leave voluntarily.
Really? Even with legal status?
Yes, out of fear. They worry about the shifting landscape, maybe potential future changes, the possibility of family separation if they have mixed status households, or just the increased scrutiny. It creates this pervasive climate of uncertainty that just drives people away from a sector that desperately needs them.
So, okay, this isn't just some abstract policy debate then. It sounds like it's directly pouring gasoline on an existing fire, exacerbating these staffing crises in a very tangible way.
Precisely. Tangible is the right word. This sector was already, frankly, on shaky ground. Nursing homes especially were grappling with severe shortages, and that problem got much worse during the pandemic. Remember, they lost something like 400,000 employees?
Huge numbers.
Huge. And we've seen these vivid examples from the sources facilities actually reporting empty wings due to lack of staff rather than residents. Think about that. Beds are there, people need care, but there's no one to provide it.
That's stark.
It is. And Leading Age Wisconsin, for instance, they specifically noted major difficulties filling vacancies that refugees used to fill. And look at the projections. The demand for direct care workers is set to skyrocket, right? Between 35 and 41% increase expected from 2022 to 2037.
A massive jump in need.
Massive. But employment growth for, say, home health aides is lagging way behind, only projected at 22%. So these policies, they're hitting at the worst possible time, widening an already dangerous gap.
And what's really striking to me, beyond just filling the slots, is the connection to the quality of care. You might instinctively think, well, more staff of any kind is good. But the sources revealed something quite remarkable, didn't they? It's not just about having enough people. Research actually shows higher immigrant staffing correlates with better outcomes for patients. Things like fewer falls, less use of restraints, even lower hospitalization rates. That really challenges assumptions.
It absolutely does. It shows the unique value and perhaps specific skills or approaches these workers bring. And it wasn't just outcomes. Areas with more immigrant workers apparently weathered the pandemic staffing shortages better too. They were more resilient. So the profound risks here are directly to our most vulnerable populations, the elderly, people with disabilities, who rely on these caregivers for, basic daily tasks. And it also means, inevitably, increased burdens on families who have to step in or scramble to find alternatives. We even saw specific heartbreaking examples, patients with conditions like autism or Alzheimer's who thrive on routine, struggling immensely with caregiver turnover directly linked to deportations.
Oh, that's so.
Imagine the disruption, the distress for someone whose entire sense of security depends on that consistent caregiver, and suddenly, poof, they're gone.
Yeah, that puts a very human face on the statistics.
Mm.
Okay, let's zoom out for a moment. What does all this mean for the broader economy and society? We hear critics arguing these deportations could actually harm the economy.
They do argue that. The reports indicate immigrants often fill these care roles that are, let's be honest, often less attractive to native-born workers. The pay is low median annual income, around $34,000 to $38,000, and the conditions are incredibly demanding physically and emotionally.
Right, tough work.
Very tough. So the argument is simply removing these workers doesn't automatically mean others will rush to fill those specific jobs, especially at those wages. And then there's the whole gray market issue.
The informal caregivers.
Exactly. This largely unregulated sector, people paid under the table perhaps, operating outside official channels, undocumented workers are particularly prevalent there. Removing them creates these immediate, almost unfillable voids because there's no formal system, no agency ready to backfill those roles instantly. It just leaves people without care.
Now, it's important we note some groups, like the Center for Immigration Studies, they present a counterargument.
Right.
They suggest reducing immigrant labor might force wages up to attract U.S.-born workers.
That is their argument, yes. And it's important to represent that perspective. However, it's also crucial to note, as the sources we looked at observed, that the actual evidence suggests a minimal wage suppression from immigrant workers. So the data doesn't necessarily support that counterargument strongly.
Okay, good clarification.
But beyond the pure economics, which can be debated, look at the wider social implications. The human cost. Deportations profoundly disrupt family structures. They cause significant trauma, especially in what are called mixed-status households.
Where some family members might be citizens or have legal status, and others don't.
Precisely. So this isn't just about losing a worker from a nursing home. It's about potentially tearing apart families, impacting children who are citizens, creating instability in communities. The ripple effects are huge.
So given all these challenges, the staffing, the quality concerns, the economic social costs, what's the industry itself doing? Are they just accepting this? Reports mention attempts by major organizations like Leading Age, the Home Care Association of America. They seem to be advocating for solutions.
They are definitely trying. They're actively pushing for immigration reforms. Things like proposing a dedicated home care visa or expanding existing work visas to better fit the needs of the long-term care sector. They see the writing on the wall.
There sounds like a but coming.
Well, the unfortunate reality, as highlighted pretty clearly in our sources, is that there seems to be little political appetite for these solutions amid the current crackdown.
So the solutions are being proposed, but maybe not seriously considered at the policy level right now.
That seems to be the situation, which means we also really need to focus on these acute regional concerns because the impact isn't uniform. Take a state like California, huge state, huge elderly population. A quarter of its population is projected to be over 60 by 2030.
A quarter, wow.
Yeah, and they're already facing widespread unfilled care hours. Add deportations into that mix. You could be looking at widespread neglect or people being forced into institutional care unnecessarily.
And it's not just the big states, is it? What about rural areas?
They're particularly vulnerable, too. Rural areas often rely heavily on community health workers, who might themselves be immigrants or refugees. Losing even a few key people in a small community can have an outsized impact. It really raises a serious question. What are the long-term societal consequences if these critical gaps in care just cannot be filled? What does that future look like?
This has been, well, a really insightful deep dive. It's clear this isn't a simple issue. We've really uncovered the profound reliance on immigrant labor in long-term care, the multifaceted impact of these current immigration policies, and how they're not just creating new problems, but deepening existing staffing shortages, posing direct risks to the quality of care people receive. And then there are the broader economic and social implications rippling out. It's complex and has immense human impact at its core.
Absolutely. And maybe as you consider everything we've discussed today, think about this. How might the long-term implications of these policies actually reshape the very definition of elder care and support systems in the U.S.? This isn't just about individual families struggling, though that's critical. It's potentially about changing the fabric of local communities, fundamentally altering our healthcare infrastructure for decades to come. It makes you ask, what kind of future are we actually building for our most vulnerable citizens?